Hi, everyone. It's Pam from Your Nurse Advocate Consulting, and welcome to this week's Tuesday Tips. Today, we're diving into everything you need to know for this year's Medicare Annual Enrollment Period, or you might hear the term AEP. So, if you're feeling overwhelmed or unsure about your choices, you're not alone, and we're here to help you get ready and with confidence. So, you might want to grab a pen and paper, whether you're watching this live with me or whether you're watching the replay. You may want to get a pen and paper and jot down some things. This is going to be probably one of the more information packed videos and Tuesday tips that we're going to do. So I want to make sure that you don't miss anything. And obviously you can go back and see it again, but we're gonna be sharing quite a bit today. So what is Medicare annual enrollment? What does that mean? So it is the period of time every year where Medicare gives you the opportunity to review your plan, look at new plans, compare them, and maybe change if you need to. And it gives you that opportunity once a year to just, hey, I want to look for something new. And that runs from October 15th to December 7th every year. So during this time, you can join, you can switch, or you can drop a Medicare Advantage plan, which is Medicare Part C. You can change your prescription drug coverage if you have a Part D plan, and you may also return to original Medicare if you'd like. Even if you're happy with your current plan, reviewing your coverage is really, really important. Plans, premiums, and covered medications can change every year, and there are already, again, some changes from last year to this year. So beginning on October 1st, which is tomorrow, insurance companies that have Medicare plans can release the updated information for 2026. So beginning tomorrow, you can start looking at the information that is going to be new for 2026. But you still can't enroll in a new plan until from October 15th on through December 7th. So let's take a look at why is annual enrollment important. And it's your one guarantee chance each year to make sure your Medicare plan still fits your need. For example, you can shop for better rates or benefits, or even look for a $0 plan. And this is often not tied to income, so anybody can research your coverage, and you may have a $0 plan. Again, the premiums you pay or you don't pay, I mean, it's real important to look at out-of-pockets. It's really important to see, are you willing to pay up front and save money if you go into the hospital, or are you willing to pay less money up front and pay more if you go into the hospital? These are all kinds of decisions that need to be made when you're looking at which Medicare option is best for you. So remember, even if you're on a $0 plan, just remember, the insurance company is still getting your Medicare Part B dollars. It comes straight out of your Social Security check, and it goes right to the insurance company. It can be anywhere around 178, 181. It depends on where you live, what your past income is, what your medical history is. Medicare assigns you that dollar amount. So you can adjust your coverage if medications or health needs have changed. Maybe you're on a more expensive medication now than you were before, and maybe on your current plan, that new medication is not a part of the formulary, which means it's not on their drug plan for you. So maybe you have to change to another insurance plan or a Part D plan that has that medication that you're taking. Because if it's not on your plan, it's gonna be much, much more expensive. Another reason is you can take advantage of new offerings like expanded telehealth or lower out-of-pocket costs. Remember, the Medicare Advantage plans, which are the insurance company that gets your Medicare dollars to manage your healthcare needs, they're very competitive. There are lots of insurance companies that you can choose from. So they're always trying to budget the money they get budget the money that you pay them in your premiums, and try and offer you little extras that regular straight Medicare doesn't offer you, to try and entice you or encourage you to look at their plan. So you'll see a lot of different kind of benefits offered from these insurance companies to try and gain your business. So by reviewing your options, you can avoid really surprises and make sure you're not overpaying or missing out on important coverage. So let's look at what's new for 2026. So let's talk about some changes. So the prescription drug cap. So starting in 2026, your out-of-pocket cost for Part D prescription drugs will be capped at the 2,100. It was 2,000 last year, so it's going up $100. So what does this mean? This is really a huge for anyone with high medication costs. And actually, this was a change that was implemented last year by our government. And so what that means is if you've got maybe a high ticket or a high dollar specialty medication that, say, within 6 months, you're going to already spend your $2,000 or your $2,100 on your medications. After that, your medications will cost you zero because of that cap. And some insurance companies take it one step further, and this is an important question to ask them, is some insurance companies will let you budget that $2,000 per year. So what that means is or that $2,100 for next year, you can take that, divide that by 12 months and just pay, a little bit every month. So I'm just going to look at my calculator just real quick to see what that would be. So if it was $2,100 per year and you divide that by 12 months, that for your medications, no matter how much they cost, you would pay about $175 a month, but you'd pay that for 12 months. And so that's some of the insurance companies can help you by allowing you to make those payments like that. There is insulin and vaccine coverage. So there's more expanded coverage for insulin and certain vaccines. And there are no deductibles for recommended vaccines based on your age and your health. Now, plan premiums and formularies. So plans may change their premiums, their covered drugs, and provider network. So it's really important to make sure that you review your annual notice of change letter that comes. And most of the time, you'll get a booklet that comes from your current insurance company highlighting the changes in that are coming for this next year in 2026. So, even if you're happy with your coverage, don't get caught short where you're just let it ride and it just renews automatically. And then you're not sure of what changes, and maybe changes occur that are not in your best interest. Lastly, telehealth flexibility. Some telehealth coverage options introducing that came popular during the pandemic are expected to continue. But again, check your plan specifics. All right. So what should you bring to your enrollment meeting? So we're providing this information for a couple reasons. We're not insurance agents, so we're not going to enroll you in a plan. We have this really nice, and I think I have it here. I can maybe show it up here. We have this really nice Medicare workbook, and I know it looks backwards on the screen, but we have this really nice Medicare workbook that we use with our clients and anyone that would like to review this with us. And it walks you through all the things that you need to do to get prepared to meet with your advisor or to meet with your insurance agent. It can be very overwhelming. We go through things like lifestyle. Are you a snowbird? And we're going to get into a little bit more on that. But just know that we can help you with this. Get ready. And all the things we've talked about, we can help you sort through all those details so that you feel pretty confident when you either self-enroll with an insurance company that you've chosen, or when you meet with your advisor, that you feel confident in knowing what you want so that they can successfully meet your needs. So what should you bring? You need to bring your Medicare card, any supplemental insurance cards. It's really important to bring a current list of your medications with the dosages because, for example, I have a client that's on lisinopril. It was a new medication. The first dose was a $3 copay. It was a 20 milligram dose. Now a 30 milligram dose of lisinopril must be more popular. That was a zero copay. So even the dosage can make a difference when it comes to how much those medications are going to cost. You want to bring the names of your your preferred pharmacy, as well as your preferred doctor, because if staying with the same doctor is important with you, then you want to make sure that your plan covers your doctors. And just a brief summary of your health conditions and needs. And in the medical world, we call this a problem list, or it's just a summary of the diagnoses that the doctor has given you, or just an overview of what your treatment plan is. And also you want to bring last year's plan information, especially if you're going to be renewing or wanting to compare. And then lastly, don't forget to download or ask us, you need to just reach out to us if you're interested in working with us to complete the workbook. And so we'll talk a little bit more about that later. So, can you change your plan outside of open enrollment? So what happens when maybe you moved, or a spouse passed away, or you have some life changing event, you don't like your plan? There are a couple of special enrollment periods, or called SEPs, that allow you to change your plan. Again, if you move, lose your coverage, maybe qualify for Medicaid or your state health insurance, or your plan changes its contract with Medicare. So there's also a Medicare Advantage open enrollment period from January 1st to March 31st, where if you've chosen a Medicare Advantage plan, that's where the insurance company manages your Medicare dollars for your health care needs, then you can switch Advantage plans or go back to original Medicare. Say, for example, you start in January, and for some reason you think you made a mistake when you chose during the annual enrollment period. They do give you one more opportunity to change if you have chosen a Medicare Advantage plan, and then you can switch Advantage plans or go back to original Medicare. This is very confusing. That's why if you need help, or you want to sit down and do a consult with us, please reach out. We'll be very happy to make sure that you understand all these things before you make the choice on what type of Medicare coverage you would want for your health care. So where do you find reliable information? I'm going to go ahead and drop this in the chat here, and you can go right to Medicare.gov. You can go right to the horse's mouth and get some information there. They have links where you can compare plans. Sometimes it's daunting for people, but sometimes people are pretty savvy do-it-yourselfers, and so they want to do that themselves. So that's a great place to go. And let's look at some other resources. I'm going to give you a link too for you can check out your state's SHIP program, or this is also Medicare information for you that you can, we'll put that in the chat here so you can get that link. And there you go. And we'll go ahead and put that on the screen here briefly. Okay. And then let's move forward. And the last but not least, we're going to put our link in there if you'd like to do a consult with us and try and get all of this straightened out for you. We're very happy to do that for you. So I'm going to put that link in also in the comments here, and I will briefly put that up on the screen so you can see that as well. Okay, there you go. And all right, so let's go ahead and move on. And we've got these links over here in the corner for you. And so in closing, if you're overwhelmed, we're here for you. We can walk you through our workbook, answer questions. Some of the things that we said that we would bring this up. So some of the things in the workbook that we cover with you, it's lifestyle changes. Do you, is your doctor staying with the same doctor important to you? Do you use different doctors from different systems, different clinics that may be out of network? One may be in network, one may be out of network. Do you travel? Do you travel outside the United States? Do you travel outside the country? Here in the Midwest, it's very popular in Wisconsin for us to have aging adults that are snowbirds, and they maybe live in Arizona or Florida for a few months out of the year. And that's really good to know, especially if you're on a Medicare Advantage plan, because there's usually the network is by your county. So those are special circumstances. So these, your income level, just your medications. So a lot of things play a role in choosing your Medicare healthcare coverage. So these are some of the things that we can help you with. And again, if you have a trusted advisor, someone that you've been working with, please, they can help you with these. But again, just wanting to make sure that you know the important things that you need to do to make sure that you're getting the right plan and the right coverage. So our goal is to help you make really confident and informed choices for your health and for your budget. And so we have our Medicare Annual Enrollment Prep Workbook available. We talked to you about that. So please reach out for a free consultation. We can go over that with you and discuss that with you. And I just want to say thanks for joining me for Tuesday Tips. If you found this helpful, please share with a friend. Subscribe to our channel on YouTube for where the replays are all stored, and reach out if you need support for this enrollment season. We've got this, we've got you, and we're here to help you every step of the way. So with that being said, I'm going to say thank you so much for joining us for another Tuesday Tips, and we'll see you back here next week. Take care.